Hey, wow, what a great turnout. I'm so glad you came out tonight. My name is Gary Orrock. I'm a registered nurse. I've been a registered nurse for 33 years with direct patient contact. Now, when I was a nursing student, a hospital physician said to me, he never caught the common cold or the flu. And I said to him, how is that possible? He said, Gary, I never touched my face. Now, it wasn't until I understood of basic infection control standards that I understood exactly what he was talking about. So simple, it is absolutely brilliant. This presentation, which will be narrowed down to a 15-minute video, is not meant to replace the hospital standards of infection control, where they use personal protective equipment such as gloves, masks, gowns, and reverse isolation. It is only meant to give you, as the average person, an education on how to protect yourself from catching the common cold and other viruses. You cannot prevent 100% of all communicable diseases because every virus, every bacteria has its individual characteristics for absorption into the human body. But let's do our very best of what we have in our control to prevent acquiring those bacteria and viruses. The doctors in the 1800s had to be convinced about something so small they couldn't see it. They had to be convinced that there was such a thing as bacteria in the 1800s. They also had to be convinced about washing their hands between patient contact. Now, I think the best practices today is that we learn this, that to prevent giving yourself those bacteria and viruses. Because remember this, a bacteria and virus will not hurt you unless it enters your body. And when is the portal of entry? Most commonly, it's the eyes, the nose, and the mouth. So protect yourself, empower yourself. Don't touch. Don't touch your eyes, nose, and face. That being said, something that you just clarified is this, that the flu is airborne. Ebola is not. That being said, that a person can sneeze on a counter, ATM, or any surface and contaminate it, and then we come along and touch that surface, and then we transport that to our nose and our mouth. And that airborne virus, called the flu, can enter our body that way. People can sneeze on our face, but let's admit it. Adults, we all know to wash our hands, but we never wash our hands leaving the post office, bank, library, fast food restaurant, or grocery stores. But we do touch those things that others cough and sneeze on. Then we touch our own eyes, nose, and mouth, giving ourselves those viruses. Some viruses are very severe, and some viruses are not. Let's get started comparing the size of the flu virus with the size of the Ebola virus. They are measured in something called nanometers. The width of one human hair is 1,000 nanometers, which means you can stack 12 Ebola viruses in the width of one hair. That's how small they are. They are really small. Now, the flu virus is around 100 nanometers in size, while the Ebola virus is 80 nanometers wide, 14,000 nanometers long. It's a very long, what they call a filamentous pathogen, which means they have a lot more baseball cards on the spokes than a flu virus and can get in very small areas. Both these viruses, let's compare the signs and symptoms of both viruses. The flu virus will have its first signs and symptoms within 2 to 5 days after exposure to the flu, while the Ebola virus will have its first signs and symptoms within 5 to 21 days after exposure to the Ebola virus. Now, both viruses have the same initial symptoms: fever, headache, nausea, vomiting, and diarrhea, while the Ebola virus quickly transcends to kidney and liver failure to massive bleeding. Now, this is the part that I really don't like. Currently, the Ebola virus has a 50 to 90% mortality rate. Both are acquired through contact with body fluids of the infected person. That would be droplets from mucus, sneezing, or diarrhea. This is a concept that even every doctor in the CDC, the Centers for Disease Control, and the World Health Organization will agree upon. You will not be affected by a virus or a bacteria unless you ingest that bacteria or virus into your body. Outside your body, that virus and bacteria will not harm you. So how do you keep the bacteria and the viruses out of your body? Now, the human body has skin. It's the organism that protects us. It's made of 3 layers: the epidermis, the dermis, and the subdermis. Those 3 layers keep our precious body fluids in and keep bacteria and viruses out. If you're going to touch these surfaces, the doorknobs, the ATMs, or the countertops, and if you have healthy skin without abrasions, nicks, or cuts on your hands, you'll probably not acquire the bacteria and viruses. And it'll give you time to wash your hands before you touch your eyes, nose, and mouth. But if you do have cuts and abrasions on your hands, these viruses, including the flu and Ebola, could be on you like white on rice, and all bets are off. I've learned that repetition and a little bit of humor is a cornerstone of learning. So this DVD and this presentation will have a little repetition and a little humor. And I've always been a patient advocate. You know, in fact, when I buy someone a get well card and they don't get well, I want my $2.50 back. Do you read the back of those cards? It's $2.50 if you buy it in the United States, but it's $3.50 if you buy it in Canada. What is that, socialized medicine? But as long as you don't touch your eyes, nose, and mouth after you touch a contaminated surface that's been contaminated by the cold or flu virus, you cannot get the common cold, because the eyes, nose, and mouth are the portal of entry for those viruses and bacteria. My analogy is this: you can never become pregnant by touching a tabletop. Do we all agree on that? Yes. Now, the comparison is, the analogy is, you can never acquire a cold or the common flu by touching a tabletop, a doorknob, and an inanimate object like an ATM. You can never catch a cold or flu by touching those things. Why? Because to acquire the common cold and the flu, you have to have a portal of entry. You might say, well, what's the portal of entry for the common cold and the flu? It is the eyes, the nose, and the mouth. They touch a surface that someone else has coughed on. Or they coughed in their hands, they touch the surface, and then you touch the surface, and you transport that common cold virus or cold germ to your eyes, your nose, and your mouth. And that's basically how you acquire the cold. You're giving yourself the cold, not someone else. I mean, you know, someone can cough in your face, but let's face it, adults are smart enough not to cough in your face. Maybe children, but with adults, that's off the table. Remember this: don't touch. Don't touch your eyes, nose, and face.
Mom, wash your hands before touching your face. You don't know what's on that counter.
Oh, you're right.
Wash your hands before touching your face. Wash your hands before touching your face and stay in the human race. I love you.
Some viruses can be preventable by not giving yourself the flu, by touching your eyes, your nose, and your mouth. Oh, I forgot to mention the most important part. As soon as you get home, after touching God knows what, wash your hands. Wash your hands with soap and water. Then you can safely touch your eyes, nose, and mouth.
Nice and clean.
As of the date of this taping, about 1,000 people have died from the Ebola virus in West Africa. I pray that the Centers for Disease Control and the World Health Organization can stop this epidemic, and then it will never spread to the United States. Don't touch. Don't touch your eyes, nose, and face, and stay in the human race. These baby ducks don't have anything to do with it, but aren't they cute? But then again, it is related because the answer and the variable is always family and love. Nobody was hurt in the production of this DVD. Not the man playing Hobo Bob, not Mary, or not Jim. Or no ducks or people were hurt in the production of this video. Okay, that's it. Any questions from the audience? Okay. Okay, the question is, how can hospitals control Ebola if they can't control MRSA? MRSA is MRSA, methicillin-resistant Staph aureus. It's a bacteria that's highly resistant to our current antibiotics and is treatable with an upper level antibiotics. That's a very good question. I'd have to refer that to the CDC and the World Health Organization. They are doing the very best they can, and trust in their guidance and their protocols. And we love them, and they are doing the very best that they can. My opinions and observations are my own, and not of the opinion or observation of any organization. And there's one more thing I want to verify and for you to remember. For your own healthcare needs, please consult your own doctor and follow the recommendations of the Center for Disease Control and the World Health Organization, because they are the utmost experts. Be healthy and enjoy life. Remember, don't touch your face and stay in the human race. Thank you very much, guys. I love you all.